Hey guys, tonight we begin with a headache. Not your headache, hopefully, but the kind of headache that ancient people looked at and thought, you know what this skull needs? A small hole. So dim the lights. Maybe lower your screen brightness just a little. Get comfortable. Imagine we are gently floating backward through time, past modern pharmacies and sterile hospitals, drifting into a world where medicine was creative, confident, and occasionally deeply unhinged. Tonight, we are talking about the strangest medical practices in ancient times. The kind of treatments that make you grateful for ibuprofen. The kind of procedures that sound like dares. And we begin with one of humanity's oldest hobbies, drilling holes in each other's heads. This practice is called trepanation, from the Greek word trypanon, meaning borer, which sounds harmless, like something you'd use on wood. Not. Carl from the village. Trepanation involves scraping, drilling, or cutting a hole into the human skull. Not metaphorically, literally, removing a neat little circle of bone. And here's the soothing part. They've found trepan skulls from prehistoric times. Neolithic, Bronze Age, ancient Peru, ancient Egypt, ancient Greece. Basically everywhere humans had tools and curiosity, which suggests that at some point someone had a headache and someone else said, I have an idea. Now, to be fair, and we will be fair, many of these skulls show signs of healing. The bone grew back around the edges, which means the patient survived, sometimes for years. So this wasn't always a chaotic cave experiment. It was, in some places, a practiced and intentional procedure. Why did they do it? Well, ancient explanations are gently fascinating. In many cultures, illness wasn't just physical. It was spiritual. If you had seizures, severe headaches, mental illness, or strange behavior, it might be because something was trapped inside your head. Perhaps a spirit, or a demon, or just some very inconvenient energy. And the solution? Let it out. A neat little window in the skull. Fresh air for the soul. There is something oddly calm about the confidence. No x-rays. No anesthesia, as we understand it. Just a stone tool, a steady hand, and a patient who probably wished they had stayed home that day. The ancient Peruvians, especially during the Inca period, were surprisingly skilled at this. Some studies suggest survival rates that rival early modern European surgery, which is both impressive and slightly alarming. They even adjusted techniques depending on the injury. Sometimes they trepanned after head trauma from battle. A depressed skull fracture? Just remove the damaged section. Clean it up. Smooth it out. Because why not do neurosurgery with bronze tools? It's worth remembering that in many cases, this may have actually helped relieve pressure from brain swelling after injuries. Which means occasionally, the hole in the head approach was medically reasonable. And that's the strange rhythm of ancient medicine. Sometimes it was mystical guesswork. Sometimes it was oddly practical. And sometimes it was both at once. Now, let's gently float over to ancient Egypt. The Egyptians, as usual, were very organized about everything, including health. They left behind medical papyri, like the Ebers Papyrus and the Edwin Smith Papyrus, filled with treatments and observations. The Edwin Smith Papyrus is surprisingly clinical. It describes head injuries and carefully notes symptoms. There's even a kind of tree of system. An ailment I will treat, an ailment I will contend with, an ailment not to be treated, which is a very calm way of saying, we're not touching that. They recognized brain tissue. They noted cerebrospinal fluid. They understood that head injuries could cause paralysis. And yet, if you had a toothache, they might recommend a mixture of crushed mouse and honey applied to the gums. A whole mouse, ground up. Because ancient medicine is never one thing. It's a careful observation of anatomy, followed immediately by rodent paste. Honey, at least, was a good antiseptic. So that part makes sense. The mouse is less scientifically defensible. The Egyptians also loved amulets. If you were ill, you didn't just get a treatment. You got magic.
Charms.
Incantations. Small carved gods keeping an eye on your spleen. It was holistic care. Very holistic. Now, let's drift eastward to ancient Mesopotamia. Here, medicine was deeply entangled with religion. Illness could be caused by angry gods, ghosts, or curses. So the healer might be both physician and exorcist. You might receive herbal remedies alongside ritual chanting. Imagine having a fever. You're sweating. You feel awful. And your doctor is waving incense around you and whispering to invisible entities. Comforting. In a way, they used plant-based treatments, some effective, some questionable. Licorice, myrrh, beer mixtures. Beer was medicinal in many cultures. Honestly, beer solved a lot of problems in antiquity. Hydration, calories, mild sedation, possibly courage before trepanation. Now, let's ease into ancient Greece, the land of philosophy, democracy, and humors. The Greeks, especially under Hippocratic medicine, developed the theory of the four humors: blood, phlegm, yellow bile, and black bile. Health was balance. Illness was imbalance. Too much blood? You're feverish. Too much black bile? Melancholy. Too much phlegm? Well, you can imagine. The solution was to rebalance. Through diet. Through purging. Through bleeding.
Ah, yes.
Bloodletting. A timeless classic. If something was wrong, perhaps you just had too much blood. So they would remove some. With knives. Or leeches. Leeches became little freelance surgeons. Quiet. Slippery. Dedicated. And bloodletting would remain popular for, about 2,000 years. Which is impressive branding for a medical practice. Now, to be fair, sometimes reducing blood volume can lower blood pressure. In rare cases, it might have provided temporary relief. But often, it simply made already weak people weaker. Still, the theory felt elegant. For humors. For elements. Balance. Harmony. It was neat. Symmetrical. Philosophical. And humans love neat explanations, even when they involve strategic bleeding. Now, let's gently slide over to ancient Rome. The Romans inherited Greek medical ideas and added their own efficiency. Public baths, aqueducts, sanitation systems. They understood hygiene better than many later societies, which is mildly ironic. Roman surgeons had tools that look surprisingly modern. Scalpels, forceps, bone drills. They performed cataract surgery. Yes, cataracts. They used a needle to push the cloudy lens out of the line of sight. No anesthetic. Just commitment. Imagine lying there while someone carefully inserts a sharp instrument into your eye. Stay very still. Very still. And yet, some patients regained partial vision, which suggests that ancient medicine was not pure chaos. It was experimentation, trial and error. Heavy on the error, occasionally brilliant. Now, let's wander further east to ancient China. Traditional Chinese medicine developed its own elegant system. Instead of four humors, there was qi, the life force, and yin and yang, balance again. Always balance. Acupuncture emerged from this worldview. Thin needles placed at specific points to redirect energy. Unlike trepanation, acupuncture is still practiced today, which suggests that this ancient technique found lasting legitimacy. Herbal medicine flourished as well. Ginseng, ginger, complex formulas carefully documented. Some of these herbs contain compounds modern pharmacology now studies seriously. So again, we see the pattern. Ancient medicine was not ignorant. It was working with the tools and frameworks available. But then there were the slightly stranger ideas. In various ancient cultures, animal dung was used medicinally. Crocodile dung as a contraceptive in Egypt. Yes, that was a sentence. Applied internally. Ancient women deserve medals. The theory may have been that its acidity created a barrier, which is inventive. We will not dwell on it. We are trying to sleep. Now, let's softly consider another recurring ancient practice, mummified remains as medicine. In later antiquity and into the medieval world, powdered mummy, ground up human remains from Egyptian mummies, was sold as a remedy. For headaches, bruises, internal bleeding, there was something about ancient bodies that felt potent, preserved, mystical, which led to an awkward side industry of looting tombs for pharmaceutical purposes. Medicine and grave robbery, a classic partnership. As we move slowly through these practices, a pattern emerges. Ancient medicine was deeply human. It combined observation, belief, fear, creativity, and sometimes genuine insight. People wanted relief. They wanted explanations. They wanted control over the fragile experience of being alive in a world without antibiotics. So they drilled holes. They bled. They burned herbs. They whispered incantations. They applied honey and occasionally mice. And through all of it, they were trying to understand the body, trying to soothe pain, trying to outwit mortality. It's easy to smile gently at the strangeness. But in 2,000 years, perhaps someone will look back at our own medical era and think, you mean they just swallowed pills? For everything. Which, honestly, sounds suspicious when you phrase it that way. So as we drift toward the end of this first stretch of strange ancient medicine, imagine the quiet determination of a healer sitting by firelight. Tools laid out. Herbs drying. A patient waiting. No MRI machines. No sterile gloves. Just experience, tradition, and a steady hand. Sometimes they got it wrong. Sometimes they got it surprisingly right. And sometimes they simply drilled a small hole in your head and hoped for the best. Take a slow breath. We're only getting started. In our next gentle wander, we'll explore ancient surgical experiments, cosmetic procedures that aged questionably, and the surprisingly creative ways people tried to cure baldness. Because of course they did. Let's continue. Part 2. Baldness, bronze tools, and the quiet confidence of leeches. All right, let's gently pick up where we left off. You're still comfortable. Hopefully horizontal. The lights are still low. The world is quiet. And somewhere, in a dusty ancient marketplace, a man is very concerned about his hairline. Because some things never change. Let's begin with baldness. A universal anxiety. Empires rise and fall, but receding hairlines remain undefeated. In ancient Egypt, hair was serious business. Wigs were fashionable, elaborate, symbolic. Clean-shaven heads were common, especially among priests, but hair still mattered deeply. So when it began to thin, remedies followed. The Ebers Papyrus includes recipes for hair growth. One involves a mixture of fats from various animals: lion,
Hippo. Crocodile. Snake.
ibex. Just a casual zoo blended into ointment. The idea was simple. If the animal was strong, or majestic, or had good hair, perhaps rubbing its essence onto your scalp would transfer that power. It's sympathetic magic, which is a polite way of saying, we are guessing. There is something almost sweet about it. The belief that strength could be borrowed, that hair might respond to ambition. Of course, applying crocodile fat to your head in the Egyptian heat probably created a scent. But beauty requires sacrifice. Let's float gently to ancient Greece again, where Hippocrates himself reportedly struggled with baldness.
Yes.
The father of medicine, bald, which is humbling. He allegedly created a topical mixture of opium, horseradish, pigeon droppings, beetroot, and spices. And if you're thinking, that sounds unpleasant, you are correct. Pigeon droppings, in particular, were a recurring ingredient in ancient medicine. Something about their dryness, or perhaps availability. Cities have pigeons. They are generous. The treatment did not restore Hippocrates' hair, which is almost comforting. Even brilliant physicians could not outwit biology. Now, speaking of substances people willingly applied to themselves, let's drift into ancient cosmetics and skin treatments. In Rome, pale skin was fashionable. It signaled status. You did not labor in the fields. You remained indoors, gracefully unproductive. To achieve this porcelain look, some Roman women used lead-based face powders.
Lead.
It gave a lovely white finish.
Smooth.
Elegant. Slowly poisonous. Over time, lead poisoning caused skin damage, hair loss, fatigue, and neurological issues, which, ironically, may have required further medical treatment. A self-sustaining cycle. There was also the use of mercury in cosmetics, particularly later, but rooted in ancient traditions. Mercury could lighten skin. It could also destroy kidneys. But for a while, it worked. And that is the theme we keep encountering. Short-term improvement. Long-term regret. Now, let's quietly examine dentistry. Because ancient dental care was imaginative. In ancient Rome, if you had a toothache, you might try rinsing with urine, fresh or aged. Roman physician Scribonius Largus recommended it. Urine contains ammonia, which can clean. So, chemically, this was not entirely absurd. Socially? Questionable. The Romans even imported Portuguese urine because it was considered particularly strong. There was a tax on urine collection under Emperor Vespasian, which means someone somewhere was a professional urine supplier. History is full of career paths you do not expect. Meanwhile, in ancient Mesopotamia, toothaches were sometimes attributed to toothworms, tiny invisible creatures burrowing into the tooth, causing pain. The treatment involved incantations, herbs, and sometimes attempts to physically remove the worm. The worm did not exist, but the pain certainly did. It's fascinating how often ancient medicine tried to personify illness. Worms, spirits, demons, something tangible to blame. Because random pain is intolerable. A worm, at least, is an enemy. Let's glide softly toward ancient surgery again. Without modern anesthesia, surgery required creativity. In some cultures, patients were given alcohol. A lot of it. Opium was used in various ancient societies. Mandrake root as well. It contains alkaloids that can induce sleep and hallucinations. But dosing was imprecise. Too little and the patient screams. Too much, and the patient quietly never wakes up. Ancient surgeons walked that line with unnerving calm. In India, around the 6th century BCE, the physician Sushruta described detailed surgical techniques. Rhinoplasty in particular.
Yes.
Nose reconstruction. In some regions, nose amputation was a punishment for crimes. So there was demand for repair. Sushruta's method used a flap of skin from the forehead to reconstruct the nose. Remarkably, this technique influenced modern plastic surgery, which means ancient India contributed to what we now call cosmetic reconstruction. So again, ancient medicine oscillates between horrifying and impressively advanced. Let's drift into ancient obstetrics. Childbirth has always been dangerous. In antiquity, it was especially so. Midwives relied on herbal mixtures,
Oils.
massage, incantations. In ancient Egypt, there were pregnancy tests involving barley, and wheat. A woman would urinate on grains. If they sprouted, she was pregnant. Amazingly, modern studies suggest this may have had some basis. Hormones in urine can influence plant growth. So occasionally, ancient intuition brushed up against science and accidentally shook hands. But not always. Some labor remedies included fumigating the womb with smoke, or inserting substances meant to encourage the baby. We will not go into detail. We are staying calm. Just imagine the determination of women navigating childbirth in a world without antiseptics. Now, let's gently consider mental health in ancient times. In Greece and Rome, mental illness was often framed within the humor system. Too much black bile caused melancholy. Treatments included diet changes, exercise, music therapy. Music therapy is actually quite gentle, almost progressive. But there were harsher methods, bloodletting again,
Purging.
and occasionally trepanation resurfaced as a solution for mental disturbances. Hole in head, release pressure, release spirits. It is a surprisingly durable idea. In ancient China, mental illness could be attributed to imbalances in qi or disruptions of yin and yang. Herbal treatments and acupuncture were used. In Mesopotamia, exorcism rituals addressed spirit possession, which, if nothing else, gave the patient a narrative, a reason. Humans crave reasons. Now, let's wander into one of the more quietly unsettling ancient remedies, animal-based medicine. Part 3, a little bit of poison as a treat. All right, settle back in. Adjust your pillow if you need to. We are now entering that particularly delicate corner of ancient medicine where the line between remedy and assassination attempt becomes interpretive. Because tonight, we're talking about poisons. Specifically, poisons that people willingly swallowed. For health. Of course they did. Let's begin with ancient Greece, where physicians were deeply interested in the properties of plants. The Mediterranean world was full of them, herbs, roots, resins. Some healing, some deadly, some both, depending on the mood. Take hemlock. Yes, that hemlock. The one associated with the death of Socrates. In small, controlled amounts, certain toxic plants were believed to have medicinal properties.
Sedatives.
Pain relief. Muscle relaxation. The problem, as you may gently suspect, was dosage. Ancient pharmacology did not come with precise measuring spoons. There were no milligrams, no standardized extracts, just crushed leaves and hope. Too little and nothing happens. Too much and you join Socrates. And yet, physicians experimented. Carefully. Sometimes bravely. Sometimes recklessly. Opium, derived from poppies, was widely used across ancient civilizations, Mesopotamia, Egypt, Greece, Rome, India. It was a powerful painkiller, a sedative, a sleep aid. The Sumerians even referred to the poppy as the joy plant, which feels like a soft understatement. Opium could ease suffering in a world full of suffering. Surgery, childbirth, injuries. It dulled the sharpness of existence. But dependence was not fully understood. Long-term effects were mysterious. Still, in a time without modern anesthesia, it was one of the few reliable comforts. Now, let's drift toward ancient Rome, where Pliny the Elder enthusiastically cataloged remedies in his natural history. Pliny believed deeply in the medicinal potential of the natural world.
Stones. Plants.
Animals. Odd combinations thereof. He also occasionally recommended substances that were, how shall we say, bold. For example, small amounts of arsenic were used medicinally in various ancient traditions. Arsenic. The quiet, tasteless classic. In tiny quantities, it was believed to treat certain skin conditions and respiratory issues. In larger quantities, it treated inheritance disputes. The theory was simple. If something was powerful enough to kill, perhaps in moderation it could strengthen. There is a strange logic there. Dangerous things feel potent. Potent things feel medicinal. This idea persisted for centuries. Even into the 19th century, arsenic tonics were sold as health boosters. Because humanity is consistent. Let's float eastward to ancient China, where alchemy blended with medicine. Chinese alchemists sought immortality, naturally, and in the process, they experimented with mercury and other minerals. Mercury was thought to have transformative properties. It flowed like liquid metal. It shimmered. It seemed alive. Surely something that magical could extend life. Instead, it often shortened it, dramatically. Several Chinese emperors are believed to have died from consuming mercury-based elixirs meant to grant eternal life. The irony is so gentle it barely needs commentary. The pursuit of immortality, achieved in reverse. But within traditional Chinese medicine, there was also remarkable herbal sophistication. Texts like the Shinnong Benchao Jing cataloged hundreds of substances. Roots,
leaves,
minerals. Some were toxic in large doses but therapeutic in small ones. A careful balance. And once again, we see that ancient practitioners were not blindly chaotic. They observed effects. They recorded reactions. They adjusted. They simply lacked microscopes. Now, let's ease into ancient India, where Ayurvedic medicine flourished. Ayurveda emphasized balance among bodily energies, dashas. Veda,
pitta,
kapha. Treatments included diet, herbs, massage, detoxification practices, and sometimes the controlled use of toxic substances. There was a branch known as Rasa Shastra, which involved the use of metals and minerals, including mercury, processed in elaborate ways. The belief was that through purification and combination with herbs, toxic materials could become healing. Sometimes this was partially true. Processing could reduce toxicity. Sometimes it was optimistic, but the effort involved was meticulous. Heating, grinding, mixing, repeating. It was chemistry in its early poetic form. Now, let's gently consider something called theriac. Theriac was a famous ancient antidote, originally developed in Greece and refined in Rome. It was meant to protect against poison, which makes sense in a political environment where being poisoned was a reasonable concern. Theriac contained dozens of ingredients. Herbs, spices, honey, sometimes opium, occasionally bits of snake flesh. Because if you fear poison, perhaps you should ingest a tiny bit of everything, just to be safe. It became so popular that it was manufactured for centuries. People trusted it deeply. It probably did very little, but it provided psychological comfort. And honey is antimicrobial. So there was that. Now, let's wander into ancient Egyptian pharmacology again. Egyptians used castor oil as a laxative, which is still effective. They used willow bark for pain. Willow bark contains salicin, a precursor to aspirin. So somewhere along the Nile, someone chewed bark and felt relief. That is a beautiful continuity. But they also used remedies like crocodile dung, as we mentioned before, and various mineral powders whose long-term effects were less charming. Medicine was a spectrum. Now, let's drift into a slightly darker but strangely calm practice, the idea of building tolerance to poison. In the ancient world, rulers feared assassination. So some allegedly practiced Mithridatism, named after King Mithridates VI of Pontus. He supposedly ingested small doses of poison regularly to build immunity. Microdosing death. There is something oddly disciplined about it. A daily ritual. A cautious sip of potential disaster. Whether it worked is debated, but the idea persisted, that the body could be trained. That danger could become manageable through familiarity. It's almost philosophical. Now, let's gently examine the use of animal venoms. In some ancient traditions, small amounts of snake venom were explored for medicinal use. Venom affects blood clotting, nerves, and pain pathways. Modern medicine studies these properties carefully. Ancient healers did not have the biochemical explanation. They only had outcomes. Part 3: A little bit of poison as a treat. All right, settle back in. Adjust your pillow if you need to. We are now entering that particularly delicate corner of ancient medicine where the line between remedy and assassination attempt becomes interpretive. Because tonight, we're talking about poisons. Specifically, poisons that people willingly swallowed. For health. Of course they did. Let's begin with ancient Greece, where physicians were deeply interested in the properties of plants. The Mediterranean world was full of them: herbs, roots, resins. Some healing, some deadly, some both, depending on the mood. Take hemlock. Yes, that hemlock. The one associated with the death of Socrates. In small, controlled amounts, certain toxic plants were believed to have medicinal properties.
Sedatives.
Pain relief. Muscle relaxation. The problem, as you may gently suspect, was dosage. Ancient pharmacology did not come with precise measuring spoons. There were no milligrams, no standardized extracts, just crushed leaves and hope. Too little and nothing happens. Too much and you join Socrates. And yet, physicians experimented. Carefully. Sometimes bravely. Sometimes recklessly. Opium, derived from poppies, was widely used across ancient civilizations: Mesopotamia, Egypt, Greece, Rome, India. It was a powerful painkiller, a sedative, a sleep aid. The Sumerians even referred to the poppy as the joy plant, which feels like a soft understatement. Opium could ease suffering in a world full of suffering. Surgery, childbirth, injuries. It dulled the sharpness of existence. But dependence was not fully understood. Long-term effects were mysterious. Still, in a time without modern anesthesia, it was one of the few reliable comforts. Now, let's drift toward ancient Rome, where Pliny the Elder enthusiastically cataloged remedies in his natural history. Pliny believed deeply in the medicinal potential of the natural world.
Stones. Plants.
Animals. Odd combinations thereof. He also occasionally recommended substances that were, how shall we say, bold. For example, small amounts of arsenic were used medicinally in various ancient traditions. Arsenic. The quiet, tasteless classic. In tiny quantities, it was believed to treat certain skin conditions and respiratory issues. In larger quantities, it treated inheritance disputes. The theory was simple. If something was powerful enough to kill, perhaps in moderation it could strengthen. There is a strange logic there. Dangerous things feel potent. Potent things feel medicinal. This idea persisted for centuries. Even into the 19th century, arsenic tonics were sold as health boosters. Because humanity is consistent. Let's float eastward to ancient China, where alchemy blended with medicine. Chinese alchemists sought immortality, naturally. And in the process, they experimented with mercury and other minerals. Mercury was thought to have transformative properties. It flowed like liquid metal. It shimmered. It seemed alive. Surely something that magical could extend life. Instead, it often shortened it, dramatically. Several Chinese emperors are believed to have died from consuming mercury-based elixirs meant to grant eternal life. The irony is so gentle it barely needs commentary. The pursuit of immortality, achieved in reverse. But within traditional Chinese medicine, there was also remarkable herbal sophistication. Texts like the Shinnong Benchao Jing cataloged hundreds of substances. Roots.
Leaves.
Minerals. Some were toxic in large doses but therapeutic in small ones. A careful balance. And once again, we see that ancient practitioners were not blindly chaotic. They observed effects. They recorded reactions. They adjusted. They simply lacked microscopes. Now, let's ease into ancient India, where Ayurvedic medicine flourished. Ayurveda emphasized balance among bodily energies, dashas. Veda,
Pitta,
kapha. Treatments included diet, herbs, massage, detoxification practices, and sometimes the controlled use of toxic substances. There was a branch known as Rasa Shastra, which involved the use of metals and minerals, including mercury, processed in elaborate ways. The belief was that through purification and combination with herbs, toxic materials could become healing. Sometimes this was partially true. Processing could reduce toxicity. Sometimes it was optimistic, but the effort involved was meticulous. Heating, grinding, mixing, repeating. It was chemistry in its early poetic form. Now, let's gently consider something called theriac. Theriac was a famous ancient antidote, originally developed in Greece and refined in Rome. It was meant to protect against poison, which makes sense in a political environment where being poisoned was a reasonable concern. Theriac contained dozens of ingredients: herbs, spices, honey, sometimes opium, occasionally bits of snake flesh. Because if you fear poison, perhaps you should ingest a tiny bit of everything, just to be safe. It became so popular that it was manufactured for centuries. People trusted it deeply. It probably did very little, but it provided psychological comfort. And honey is antimicrobial. So there was that. Now, let's wander into ancient Egyptian pharmacology again. Egyptians used castor oil as a laxative, which is still effective. They used willow bark for pain. Willow bark contains salicin, a precursor to aspirin. So somewhere along the Nile, someone chewed bark and felt relief. That is a beautiful continuity. But they also used remedies like crocodile dung, as we mentioned before, and various mineral powders whose long-term effects were less charming. Medicine was a spectrum. Now, let's drift into a slightly darker but strangely calm practice, the idea of building tolerance to poison. In the ancient world, rulers feared assassination. So some allegedly practiced Mithridatism, named after King Mithridates VI of Pontus. He supposedly ingested small doses of poison regularly to build immunity. Microdosing death. There is something oddly disciplined about it. A daily ritual. A cautious sip of potential disaster. Whether it worked is debated, but the idea persisted, that the body could be trained. That danger could become manageable through familiarity. It's almost philosophical. Now, let's gently examine the use of animal venoms. In some ancient traditions, small amounts of snake venom were explored for medicinal use. Venom affects blood clotting, nerves, and pain pathways. Modern medicine studies these properties carefully. Ancient healers did not have the biochemical explanation. They only had outcomes. Sometimes swelling reduced. Sometimes pain changed. Sometimes the patient did not survive. And that uncertainty was simply part of life. There were no clinical trials, no regulatory boards, just reputation. If a healer's patients survived often enough, trust grew. If not, well, there were always other healers. Now, let's pause gently on the psychological aspect of all this. Taking a dangerous substance as medicine requires faith. Faith in the healer. Faith in tradition. Faith that the risk is worth it. In a world without antibiotics, without vaccines, without germ theory, options were limited. Doing something, even something risky, felt better than doing nothing. And so people swallowed bitter tonics, metallic elixirs, suspicious powders. They believed in balance. in purification, in transformation, and sometimes, against the odds, they improved. The human body is resilient. It can survive surprising things. As we near the end of this third quiet stretch, imagine an ancient apothecary. Shelves lined with jars, dried herbs hanging from beams, mortar and pestle in steady motion. A patient arrives, complains of pain, of fever, of weakness. The apothecary considers, selects ingredients, measures by instinct, a pinch, a handful, a careful drop. There is no malicious intent, no theatrical villainy, just effort. Effort to help. Even when the tools are imperfect, even when the understanding is incomplete. Ancient medicine was not foolishness. It was early science wrapped in myth. Observation mixed with symbolism. Courage mixed with guesswork. And occasionally a little bit of poison. As a treat, take another slow breath. In our next gentle wander, we'll explore ancient surgical tools in more detail, strange treatments for beauty and aging, and the quiet determination with which humans have always tried to hold on to youth. Because no era has ever accepted wrinkles peacefully. Let's continue drifting. Part 4. Bronze scalpels and the very serious war on wrinkles. All right, we continue.
Slowly, gently.
Somewhere in the ancient world, a surgeon is laying out tools made of bronze. They are polished, sharp, slightly intimidating, and absolutely not sterile by modern standards. But they are the best available. So, let's float into ancient operating rooms, which were usually just well-lit rooms, with maybe a table, or a bench, or a patient gripping something wooden and whispering a quiet prayer. Ancient Egyptian surgical instruments were surprisingly sophisticated. Archaeologists have found scalpels, hooks, probes, forceps, even what looks very much like a speculum, which suggests that gynecological exams were happening thousands of years ago.
Calmly,
methodically, the Edwin Smith Papyrus describes wound care with remarkable clarity. Clean the wound. Stitch if necessary. Apply honey. Honey again. Always honey. And honestly, honey deserves its own monument. It is antibacterial. It helps wounds heal. Ancient Egyptians were onto something there. But surgery without anesthesia is focused. Patients were sometimes given alcohol, or opium mixtures, or simply told to be brave. And brave they were, because the alternative was infection,
or death,
or living with a broken limb that never healed properly. Now let's drift to ancient Rome, where battlefield surgery was common. Roman military doctors called medici followed armies. They treated wounds from swords, spears, arrows. They had specialized tools for extracting arrowheads. Forceps designed for specific shapes. There's something almost tender about that specificity. Someone noticed that arrowheads break differently, so they designed tools accordingly. Roman medicine also embraced cauterization. If a wound bled too much, burn it. The smell would have been unforgettable. But cauterization can stop bleeding. And in a time before blood transfusions, stopping bleeding was everything. Of course, the risk of infection remained high. Without understanding bacteria, ancient surgeons relied on visible cleanliness. Washing with wine. Applying vinegar. Wine contains alcohol. Vinegar is acidic. Both mildly disinfectant. Again, not foolish. Just incomplete. Now, let's gently pivot to cosmetic procedures. Because humans have always wanted to look slightly better than they do. In ancient Rome, wrinkles were unwelcome. Hair loss, as we discussed, was distressing. Skin blemishes were treated with creams made of animal fats, ashes, and occasionally lead. But there were also early forms of cosmetic surgery. In ancient India, as we mentioned before, rhinoplasty was practiced. Skin grafting techniques were described in detail by Sishra. These weren't purely aesthetic procedures. Often they repaired injuries or punishments. But the desire to restore appearance was real. Imagine losing your nose in a society where face and honor are intertwined. Reconstruction wasn't vanity. It was survival. And yet, even in ancient times, vanity did exist. Roman women applied creams made of crocodile fat to smooth skin. Some used masks made of bread soaked in milk, which is basically ancient skincare. Cleopatra herself was said to bathe in milk. Lactic acid can gently exfoliate, so perhaps there was logic beneath the legend. Though maintaining a steady supply of milk for bathing suggests a very committed dairy operation. Now, let's drift into ancient dentistry again, but slightly more mechanical this time. The Etruscans in pre-Roman Italy created dental bridges using gold bands to hold replacement teeth in place.
Yes.
Ancient dental prosthetics, human or animal teeth, were sometimes wired into the mouth. Gold was flexible and resistant to corrosion. A surprisingly clever choice. It wasn't perfect, but it allowed people to chew, to smile, and that matters. Now, let's talk about aging. Aging has always been slightly offensive to humanity. In ancient China, alchemists searched for elixirs of youth. We mentioned mercury, but there were also herbal formulas promising vitality and longevity. Ginseng became associated with life force,
Strength.
masculinity. In Rome, Pliny recommended various tonics to restore youth. Goat's milk, certain herbs, even crushed pearls dissolved in vinegar.
Pearls.
Because beauty should be ingested, apparently. In ancient Egypt, anti-aging creams included frankincense and myrrh, both aromatic resins. Pleasant, luxurious. Did they reverse aging?
No.
Did they make people feel cared for?
Probably.
And sometimes that's half the medicine. Now, let's softly examine one of the more unusual ancient practices, blood as a cosmetic. In Rome, some believed that applying the blood of gladiators to the skin could treat epilepsy or enhance vitality. Blood was seen as life, pure life, which makes sense symbolically, less so medically. There's something deeply human about this pattern. The idea that life can be transferred, that youth can be borrowed. We see it again and again. Animal organs for strength, precious minerals for glow, dangerous elixirs for immortality. Now, let's wander quietly into ancient orthopedic treatments. Broken bones were set with splints made of wood or bark, bandaged tightly, supported with linen. In some Egyptian mummies, healed fractures have been found, properly aligned, which means someone knew what they were doing. There were even prosthetic toes discovered in ancient Egypt, carefully crafted, functional. A prosthetic toe, 3,000 years ago. That is quietly extraordinary. And yet, for all the skill, pain management remained limited. Imagine a bone being set, the snap back into place. No sterile gloves. No anesthetic injection, just firm hands and perhaps a strong drink. And still people endured. Now, let's gently consider infections. Before germ theory, infections were mysterious. A wound might look clean, then swell, redden. Fever would follow. Ancient healers described these symptoms carefully. They just didn't know about bacteria. Some cultures used moldy bread on wounds, which sounds unsanitary. But certain molds produce antibiotics. We are brushing very close to penicillin, thousands of years early. It wasn't understood. It wasn't standardized. But it hints at observation. Now, let's float into something softer. Massage therapy. In ancient China and India, massage was an integral part of healing. stimulating circulation, relaxing muscles, restoring balance. This is perhaps one of the least alarming ancient practices. Touch is medicine.
Calm. Steady. Human.
Across cultures, we see it again. Rubbing oils into skin, stretching limbs, applying warmth. Not every ancient treatment involved holes, poisons, or pigeon droppings. Some were gentle. As we near the end of this fourth quiet stretch, notice how ancient medicine oscillates between brutality and tenderness. A cauterized wound on one side, a milk bath on the other, a bronze scalpel here, a soothing herbal compress there. It was a world without certainty. So people tried everything. They tried science before science had a name. They tried magic because magic felt reassuring. They tried courage, and sometimes denial. And through it all, they kept living, aging, hoping. Take another slow breath. In our next gentle wander, we'll explore ancient reproductive medicine, unusual fertility rituals, and the very creative lengths humans have gone to in order to produce heirs. Because in ancient times, having children wasn't just personal. It was political. And that, naturally, made everything more complicated. Let's continue drifting. Part 5. Fertility, fig leaves, and very determined dynasties.
All right.
We drift onward.
Calmly.
The torches are still flickering. The herbs are still drying in neat little bundles. And somewhere in the ancient world, a royal couple is staring at each other with quiet panic. Because they need an heir. And nothing is happening. In ancient times, fertility was not just a personal matter. It was survival. It was inheritance. It was the difference between dynasty and chaos. So, naturally, medicine became very interested in reproduction. Let's begin in ancient Egypt, where fertility was woven into religion and medicine in equal measure. If a woman struggled to conceive, physicians might prescribe herbal pessaries, mixtures inserted into the body to encourage pregnancy. Some ingredients included honey, acacia gum, and dates. Acacia gum is interesting. When fermented, it can produce lactic acid. Lactic acid can act as a mild spermicide. So, ironically, some fertility treatments may have functioned as contraception. Ancient irony is very patient. Egyptians also had early pregnancy tests, as we mentioned briefly before. A woman would urinate on barley and wheat seeds. If they sprouted, pregnancy was likely. Modern studies have suggested there might have been some biological basis to this. Hormonal changes in urine can influence plant growth, which means somewhere along the Nile, someone discovered a faint whisper of endocrinology without knowing the word. Now, let's gently float to ancient Greece. Greek medicine viewed reproduction through the lens of the humors. If a woman was not conceiving, perhaps her womb was too cold, or too dry, or too moist,
Or too something.
Treatments included warming herbs, scented oils, and fumigation.
Yes.
Fumigation again. In some cases, sweet-smelling substances were placed near the lower body while unpleasant smells were held near the nose. The theory was that the womb would be drawn toward pleasant aromas. The wandering womb theory was quite popular. The idea was that the uterus could roam the body, causing suffocation, hysteria, mood swings. If you feel slightly judged by ancient medicine right now, you are not alone. The solution was scent manipulation. Guide the womb back into place with perfume. It's oddly gentle in concept, less gentle in execution. Now, let's drift to ancient Rome. Roman physicians adopted many Greek ideas, but added their own decisiveness. Fertility treatments included specific diets, timed intercourse recommendations, herbal mixtures, and occasionally talismans. Because when medicine feels uncertain, symbolism fills the gaps. Amulets shaped like phalluses were worn for protection and virility. The Romans were not subtle. There is something refreshingly straightforward about that. If a man struggled with impotence, remedies included everything from certain roots to animal testicles. Yes, animal testicles. The logic was sympathetic magic again. Strengthen the organ by consuming its symbolic equivalent. Did it work? Biologically, no. Psychologically? Perhaps, sometimes. And psychology matters more than ancient physicians realized. Now, let's glide eastward to ancient China. Traditional Chinese medicine approached fertility through balance, yin and yang, qi flow, organ systems. If conception failed, the problem might lie in kidney energy, or liver imbalance, or insufficient warmth in the womb. Herbal formulas were prescribed with great care. Acupuncture points stimulated. Diet adjusted. Some of these herbs may indeed have influenced hormone levels or improved general health. The approach was holistic,
Calm.
systematic, and deeply invested in producing sons. Let's be honest. In many ancient societies, the pressure for male heirs was immense, which led to additional layers of anxiety. In ancient Greece and Rome, there were also attempts to influence the sex of the child. Certain positions during intercourse were recommended. Specific days of the month favored. There were theories about left and right sides of the womb determining gender. It was all very confident, very unproven. Now, let's gently address contraception. Because while producing heirs was critical for some, others were quite interested in avoiding them. Ancient Egyptian women used pessaries made from crocodile dung mixed with honey. We mentioned this earlier. It may have created a physical barrier. The acidity might have had mild contraceptive effects, but the experience itself must have required dedication. In ancient Greece, a plant called silphium was widely used as a contraceptive. Silphium grew in North Africa, in Cyrene. It became so popular that it was harvested to extinction. An entire species gone. Because it worked. Or, at least, because people believed it worked strongly enough to trade it across the Mediterranean. Coins from Cyrene even featured its image. That is pharmaceutical branding at an impressive scale. Now, let's wander into ancient midwifery. Midwives were central figures in communities. Experienced. Practical. Calm under pressure. They used oils to ease delivery. Encouraged certain positions for labor. In ancient Egypt, women sometimes gave birth on birthing bricks, squatting supported by midwives. This upright position is actually considered beneficial in modern obstetrics. So once again, ancient intuition aligns with modern practice. But there were also more mystical elements. Incantations to fertility goddesses. Amulets worn during labor. Symbols drawn on the body. Because childbirth was dangerous. Terrifying. And in the absence of certainty, ritual offered comfort. Now, let's gently consider the darker side of reproductive medicine, attempts to ensure lineage purity. In various ancient royal families, there was obsession with bloodlines. Marriages between relatives were sometimes encouraged to preserve power. The medical understanding of genetics did not exist. But the consequences did. We won't dive into dramatic examples here. We are staying calm. But it's worth noting that attempts to control inheritance often collided quietly with biology. Nature has its own preferences. Now, let's drift toward ancient beliefs about breastfeeding and child health. Breast milk was considered powerful,
Sacred.
wet nurses were common in elite families. There were detailed discussions about what a wet nurse should eat, her temperament, her physical health, because it was believed that milk transmitted personality traits. Calm nurse, calm baby. Angry nurse, less calm baby. Science does not fully support personality transmission through milk, but nutrition and bonding certainly matter. So again, there's a shadow of truth beneath the symbolism. As we near the end of this fifth quiet stretch, notice something gentle. Ancient reproductive medicine was not only about biology, it was about fear.
Hope. Continuity.
The fear of childlessness, the fear of childbirth, the hope for healthy children, the hope for legacy. So people burned herbs, mixed honey, whispered prayers, consumed extinct plants. They tried to guide wombs with perfume. They tried to influence destiny with timing and talismans. And through trial and error, through heartbreak and relief, humanity continued. Generation after generation. Take another slow breath. In our next gentle wander, we'll explore ancient treatments for epidemic disease, the curious ways people tried to ward off plague and fever, and how medicine behaved when fear spread faster than infection. Because nothing tests a medical system quite like a mysterious illness. Let's continue drifting. Part 6. Plagues, perfumes, and the art of pretending to understand. All right, we drift now into a quieter, heavier space. The air feels different here, thicker, because we are entering the ancient world of epidemics. And nothing reveals the limits of medicine quite like a disease that spreads faster than explanation. Imagine an ancient city, narrow streets, animals nearby, water sources shared. A fever begins. One household first, then another. No microscopes. No concept of viruses or bacteria. Just symptoms. And fear. Let's begin in ancient Greece, during the plague of Athens in the 5th century BCE. Thucydides described it in detail. Fever. Red eyes. Throat inflammation. Skin lesions. People tried everything. Doctors, ironically, died in high numbers. They were exposed the most. And they had no immunity. Without understanding contagion, people searched for meaning. Some believed the gods were angry. Others thought the air itself was corrupted. Miasma theory, the idea that disease spread through bad air, became influential. And honestly, in a world where foul smells often accompanied disease, it wasn't an unreasonable guess. So, what do you do if the air is bad? You improve the smell. Perfumes. Incense. Fragrant herbs burned in homes. In ancient Rome, during later outbreaks, people carried small bouquets of flowers or herbs to clean the air around their faces. Which sounds quaint, but aromatic plants sometimes repel insects. And insects sometimes carry disease. So once again, we brush against accidental effectiveness. Now, let's gently consider quarantine. While the word itself came later, the concept of isolating the sick existed in ancient times. In some Greek cities, the ill were kept separate, not because of germ theory, but because observation suggested proximity mattered. If someone was visibly ill, distance felt wise. It wasn't formalized, but it was instinctive. Now, let's float to ancient Egypt. Egyptians believed many diseases were linked to the Nile cycles, spirits, or imbalances in bodily channels. During outbreaks, treatments focused on purifying the body. Laxatives. Emetics. Inducing sweating. The idea was to expel the illness. If something was wrong inside, push it out. It's a simple logic. Sometimes dehydration made things worse. But sometimes mild detoxification may have helped with certain infections. Again, ancient medicine was rarely entirely useless, just inconsistent. Now let's drift east to ancient China, where epidemic disease was also recorded carefully. Chinese physicians categorized illnesses by symptom patterns, fever types, cough characteristics, pulse variations. Herbal combinations were prescribed based on observed clusters of symptoms. Some herbs used in traditional formulas have antiviral or anti-inflammatory properties. The The framework, yin-yang, qi, was philosophical, but the observation was practical. Patients were watched, changes recorded, patterns noted. Now, let's gently examine ancient Rome again. During epidemics, Romans sometimes turned to public rituals, sacrifices, processions, appeals to the gods, temples filled. Because when medicine fails, ritual steps forward. There is something deeply human in that. In times of crisis, people gather. They seek reassurance. They want structure. And sometimes that gathering spreads disease further. But the need for comfort is powerful. Roman physicians continued to rely on humoral theory. If a plague caused fever, perhaps there is excess heat. So cool the body. Bleed the patient. Administer cooling herbs. Bleeding someone already weakened by infection was ambitious, but it aligned with theory, and theory felt safe. Now, let's softly explore smallpox-like diseases in ancient times. Evidence suggests that smallpox existed in ancient Egypt. Some mummies show possible pockmarks. Without vaccines, mortality could be high. Communities had little defense beyond supportive care and hope. Hope was a major treatment. Now, let's drift into one of the more persistent ancient responses to plague, protective charms. Amulets engraved with symbols. In Mesopotamia, incantation bowls were buried under floors to trap demons believed to cause illness. Demons were named,
addressed,
commanded, because naming an enemy makes it manageable. It gives shape to chaos. There's a psychological comfort there that modern people may underestimate. Now, let's consider sanitation. Ancient Rome had aqueducts, sewers, public baths. Clean water systems reduced certain diseases. But public baths also brought many bodies together.
warm,
Damp, shared spaces, which may have spread others. Ancient cities were complicated ecosystems. Now, let's gently examine one of the most persistent treatments across cultures during epidemics, purging. If disease caused vomiting or diarrhea, that was the body expelling evil. If it did not, perhaps it should. So physicians administered laxatives. Emetics. The body must be cleansed. Sometimes this aligned with the body's own immune response. Sometimes it simply exhausted the patient further. But it felt active. Doing nothing is psychologically difficult during crisis. Doing something even questionable feels better. Now, let's drift into ancient herbal fumigation. Burning rosemary,
thyme,
frankincense,
myrrh.
Some of these plants have antimicrobial properties. Burning them in enclosed spaces might reduce certain pathogens. Not enough to stop a major epidemic, but perhaps enough to make a minor difference. Ancient medicine often operated at the edge of accidental discovery.
Close,
but not quite there. Now, let's quietly consider how ancient physicians dealt with uncertainty. There were no laboratory tests, no pathogen identification. Diagnosis relied on observation.
pulse,
Skin color, breathing patterns. Hippocratic texts emphasize prognosis, predicting the course of illness. If a physician could correctly predict whether a patient would recover, trust grew. Even if treatment was limited, there's something honest about that. Admitting in coded language that some illnesses were not to be treated. Meaning beyond help. Now, let's gently reflect on how communities coped socially. During epidemics, normal life paused. Trade slowed. Fear increased. Blame sometimes followed. Outsiders were occasionally accused of bringing disease. This pattern repeats across history. Humans search for someone to hold responsible. But the microbes, though unnamed in antiquity, remained indifferent. As we near the end of this sixth quiet stretch, notice the vulnerability. Ancient medicine could set bones, stitch wounds, ease certain pains. But epidemic disease exposed its limits. And yet, even then, people did not surrender. They burned herbs. They isolated the sick when they could.
They prayed.
They experimented. They documented symptoms carefully for future generations. That documentation mattered, because over centuries, those careful notes slowly accumulated. Knowledge builds quietly, incrementally. A fever described in Athens echoes in Rome. A herbal remedy in China is refined over generations. A sanitation system in one city inspires another. And eventually, far in the future, germ theory will emerge. But for now, in the ancient world, medicine stands in the half-light.
Trying.
Observing. Sometimes guessing with confidence. Take another slow breath. In our next gentle wander, we'll explore ancient beliefs about the brain, strange neurological treatments, and the persistent idea that drilling a hole in your head might solve everything. Because as we've learned, that idea never quite went away. Let's continue drifting. Part 7. The brain, the spirits, and the very popular hole. All right. We return now to the head. Because ancient medicine did.
Frequently.
The skull, that quiet dome of mystery, fascinated and confused early healers. People knew that injuries to the head changed behavior. A blow to the temple could alter speech. A strike to the back of the skull could disturb vision. Something important was in there. But what, exactly, remained debatable for a very long time. Let's drift gently to ancient Egypt again. The Egyptians understood that the brain existed. They described it in the Edwin Smith Papyrus. They observed that head trauma could cause paralysis. They even noted that brain injuries affected the opposite side of the body, which is remarkably perceptive. And yet, during mummification, they removed the brain and discarded it. Because the heart, not the brain, was considered the seat of intelligence and emotion. The brain was packing material. This is one of history's quiet ironies. They carefully preserved the liver, lungs, stomach, intestines. They weighed the heart in the afterlife. The brain? Scooped out through the nose. It's hard not to feel mildly offended on behalf of the brain. Now, let's float over to ancient Greece. Here, the debate about the brain was intense. Some philosophers, like Aristotle, believed the heart was the center of thought. The brain, he argued, functioned as a cooling system for the blood, which sounds creative. Others, like Hippocrates, argued that the brain was the seat of sensation and intelligence. He wrote that from the brain come our pleasures, joys, laughter, and sorrows, which is surprisingly modern. But even with this insight, neurological treatments remained limited. Epilepsy, for example, was known as the sacred disease. Many believed it was caused by divine influence, a god entering the body. Hippocrates disagreed. He argued it had natural causes, which was bold. But treatment still included diet changes, purging, and occasionally bloodletting. Because humors had to be balanced. Always back to the humors. Now, let's gently return to trepanation. We met it earlier. The ancient solution to many head-related mysteries. Headache?
Whole. Seizures? Whole.
Behavioral disturbance?
Whole.
Battle injury? Definitely whole. It persisted across continents. Europe, Africa, South America,
Asia.
The consistency is almost comforting.
Different cultures.
Different languages. Same idea. Perhaps the skull needs ventilation. In some Andean cultures, trepanation techniques became refined. Surgeons avoided major blood vessels. They worked carefully around fractures. Some skulls show multiple trepanation sites, which suggests repeat customers. You have to admire the bravery, or perhaps the lack of options. Now, let's drift into ancient treatments for mental illness. In Mesopotamia, mental disturbances were often attributed to spirits. Exorcisms were performed, rituals enacted, incantations spoken carefully. The patient might wear amulets for protection. And here's the quiet truth. Ritual can calm people. Structure reduces anxiety. Community involvement provides reassurance. So while the explanation involved spirits, the social support may have had real therapeutic value. Now, let's float eastward to ancient China. Traditional Chinese medicine viewed mental health through the lens of organ systems and energy flow. An imbalance in the heart, liver, or kidney systems could affect mood. Acupuncture points were stimulated. Herbal formulas prescribed. Some herbs used historically for calming effects are still studied today. So even when the framework differed, the goal was similar: restore balance. Balance is a very comforting concept. Now, let's softly examine migraines. Headaches have always plagued humanity. In ancient Greece and Rome, migraines were sometimes treated with herbal compresses or bloodletting because too much blood in the head was suspicious. Cauterization near the temples was occasionally attempted.
Yes.
Burning the skin to distract from internal pain. There's a certain stubborn determination in that approach. Now, let's drift into sleep disorders. Insomnia in ancient times was treated with opium, mandrake, warm baths, and soothing music. Music therapy again. That one feels almost modern. Lull the nervous system.
Slow the body.
Ancient lullabies were probably not so different from ours. Now, let's gently consider stroke. Ancient physicians observed sudden paralysis, loss of speech. They didn't know about clots or hemorrhages, but they recognized patterns. Treatment often involved massage, warming the affected side, sometimes bloodletting again, and sometimes quiet acceptance, because not everything could be reversed. Now, let's wander briefly into something slightly peculiar: skull shaping. In some ancient cultures, infant skulls were intentionally shaped using boards or bindings. This wasn't medical treatment. It was aesthetic, cultural. Elongated skulls signaled status or beauty. The brain adapted. Infants grew normally, which is a reminder that the skull is surprisingly flexible. And humans are endlessly creative about appearances. Now, let's return to the idea of spirits in the head. In many cultures, hallucinations or erratic behavior were interpreted spiritually. Shamans played key roles. Shamanic healing often involved rhythmic drumming, chanting, altered states of consciousness. From a modern lens, we might see elements of psychotherapy there. Guided ritual, emotional release, structured narrative, different vocabulary, similar human needs. Now, let's gently reflect on fear. The brain controls personality, identity, memory. When something went wrong with the mind, ancient people faced a unique terror. A broken leg is visible. A broken mind is not. And without neurological science, explanations drifted toward myth. But even then, there was compassion. Families cared for afflicted members. Communities adapted. Not perfectly, not always kindly, but humanity persisted. As we near the end of this seventh quiet stretch, notice something subtle. Ancient medicine often misunderstood the brain's mechanics, but it recognized its importance. It knew the head was sacred territory. It knew injuries that were serious. It knew mood and thought could shift mysteriously. So it tried everything: herbs, ritual, music, massage, holes. Always back to the whole. There is something oddly poetic about that persistence. When you cannot see inside, you imagine what might be trapped. And sometimes you decide to give it an exit. Take another slow breath. In our next gentle wander, We'll explore ancient ideas about digestion, strange dietary cures, and the deeply held belief that most problems begin in the stomach. Because for many ancient physicians, everything eventually led back to what you ate, and whether you should have eaten less of it. Let's continue drifting.
Continue.
Part 8. The stomach knows all, apparently. All right, we drift downward now, away from the skull, past the throat, settling gently into the abdomen. Because for a very long time, ancient medicine believed that most of your problems began right here, in the stomach. Headache, digestion, sadness,
Digestion.
fever, possibly digestion. They were watching bodies react to the world and trying, sometimes overzealously, to correct what seemed out of balance. So they purged, they fasted, they brewed herbal teas, they classified foods by temperament, and they returned, again and again, to the quiet belief that if the stomach was calm, perhaps everything else would be too. Take another slow breath. In our next gentle wander, we'll explore ancient pain management more deeply, the strange ways people dulled suffering, the cultural attitudes toward pain, and the substances that made existence just a little softer around the edges. Because pain, perhaps more than anything else, has always demanded a response. And humanity has always tried to answer it. Let's continue drifting.